Riliprubart is a complement inhibitor. It's an antibody that targets the activated version of the C1s complement factor, which is essential for the activation of the complement cascade. And this means that any disease in which complement is activated to some extent, or that is antibody mediated, and this is the case of CIDP, it makes sense to inhibit the cascade that activates this complement system, because this is what ultimately enhances the immune response and the final damage to the nerve in these diseases. So this is the high level rationale of using Riliprubart in CIDP. So Riliprubart was trialed in a phase 2 that is an open label study. This open label study was aiming to check if this strategy of complement inhibition was effective or not, and safe also in CIDP. And for this purpose, it was a proof of concept study that studied a very diverse population of CIDP patients, and for this reason, it's designed in 3 different groups. There's one group that is the patients with CIDP that have a standard of care therapy, patients usually taking immunoglobulins or corticosteroids. There's another group that is labeled as treatment-refractory, that is essentially patients that either didn't respond completely or didn't respond at all, or had any type of side effect with the standard of care. And finally, there's a group of treatment-naive patients that were pure treatment-naive patients, or new onset patients, or also patients that had been under treatment for some time, but then they were stable, or they were not needing treatment anymore, and then relapsed, and this was considered also treatment-naive. So this is how the study was framed, and essentially, even if it was open label, there were some very clear criteria of go, no go, to see if this drug was effective in the different populations of CIDP. And to summarize it very, let's say, briefly, all 3 arms, all 3 groups of treatment showed positive signal, and this is why now the Riliprubart is being planned in a phase 3 trial after this proof of concept has been met. The phase trial are about to start, or just recently started, in fact, but there are still very few centers activated. But there are 2 different phase 2 trials. One is aimed to this proof of concept, this standard of care group of patients, and in this case, the aim is to compare the efficacy to immunoglobulins, to the current standard of care. So it is a trial that is ambitious in that sense, because it's not aiming only to demonstrate that the drug is effective, but also that it is at least as effective as the current standard of care. And then there is another trial that is aimed for this other population of refractory patients, which, as I mentioned before, is not necessarily very refractory, but patients that are not going completely well with the current treatment. And this is a more standard type of trial with a placebo-controlled arm. So these are the 2 phase 3 trials. We don't have any data or anything yet, because in fact there are very few centers activated, but the idea is that at the end of the year and certainly next year, they are fully activated and including patients.